In the fight against cancer, early detection is everything. The sooner a tumor is discovered, the greater the odds of effective treatment, reduced suffering, and long-term survival. But for millions of individuals living with obesity, this critical window of opportunity is too often missed. A growing body of research reveals a troubling pattern. Excess body fat not only raises the risk of developing cancer, but also delays diagnosis, leading to detection at more advanced and more lethal stages. This silent diagnostic disadvantage is one of the most dangerous and underrecognized consequences of obesity, and it is costing lives. The reasons for delayed cancer diagnoses in obese individuals are multifaceted and deeply systemic. At the most basic level, excess adipose tissue can physically mask the early signs of tumors. Palpable masses in the breast, abdomen, or soft tissues may be harder to detect in individuals with higher fat content. Swelling, bloating, or abnormal growths may be dismissed as weight gain rather than red flags for deeper pathology. Even healthcare providers, consciously or unconsciously, may overlook subtle symptoms or physical changes in obese patients because these changes blend into the background of a larger body. Symptoms like fatigue, joint pain, shortness of breath, or gastrointestinal discomfort, common early indicators of certain cancers, can be mistakenly attributed to obesity itself or its related comorbidities like sleep apnea, diabetes, or acid reflux. This diagnostic overshadowing can lead to critical delays in referral for imaging, biopsy, or specialist evaluation. By the time the true underlying cause is recognized as cancer, the disease may have already progressed beyond early, curable stages. Moreover, routine screening itself becomes more difficult and less accurate in the context of obesity. Imaging techniques like ultrasound, mammography, and CT scans often yield reduced clarity in patients with high body mass, increasing the risk of missed lesions. In breast cancer, for example, obesity has been associated with decreased mammographic sensitivity, meaning tumors can hide behind dense or fatty tissue. Similarly, colonoscopies in obese patients can be technically more challenging due to anatomical changes, increasing the risk of incomplete exams or missed polyps. Diagnostic inertia and logistical difficulties, such as weight limits on medical equipment or delays in accessing appropriately sized scanners, further compound the problem. Even the patients themselves may be less likely to seek early evaluation. Many individuals with obesity experience shame, stigma, or prior medical bias, which can discourage them from seeking regular care or voicing concerns. Negative past experiences in clinical settings, where weight is often the focus of criticism rather than support, can create long-lasting avoidance behavior. This is not mere speculation. Studies consistently show that obese patients are less likely to engage in preventive care, including cancer screenings. They are also more likely to delay follow-up appointments, sometimes out of fear, sometimes due to fatigue with medical fat shaming, and sometimes because they've been told, explicitly or implicitly, that their weight is the only thing that matters. The consequences of these delays are deadly. Obese individuals are more likely to be diagnosed with cancers at later stages, when tumors are larger, more invasive, or have already metastasized. Stage at diagnosis is one of the most important predictors of survival in nearly every type of cancer, and later detection translates directly into worse outcomes. For instance, obese women are more likely to receive a diagnosis of advanced stage breast cancer compared to normal weight women, and their survival odds are lower, even after adjusting for treatment. In colorectal and pancreatic cancers, delays in diagnosis often mean the difference between operable and inoperable disease. This is not just a clinical failure, it is a public health crisis hiding in plain sight. Obesity already increases cancer risk, but when layered with diagnostic delay, it becomes a compounded threat. It adds a second hit. Not only are tumors more likely to form, but they are also less likely to be caught early, when treatment is most effective. This double jeopardy is particularly devastating in aggressive cancers, where weeks or months of delay can drastically alter the trajectory of the disease. Yet, despite these patterns, cancer guidelines rarely account for obesity-related diagnostic challenges. Screening age thresholds, risk stratification models, and follow-up protocols often ignore body mass as a variable, even though it demonstrably affects both cancer incidence and detection. There is no systematic adjustment in timing or frequency of screenings for high BMI populations. Nor are there widespread training programs to sensitize healthcare providers to the diagnostic complexities of working with obese patients without bias or dismissal. This silence in clinical practice is mirrored by public health messaging. Campaigns that encourage early cancer detection or screening participation rarely target obese populations with tailored messages or support. There are few, if any, large-scale efforts that highlight how obesity can interfere with cancer diagnosis, or how proactive surveillance can help mitigate that risk. Without this awareness, millions remain uninformed, underserved, and ultimately more vulnerable. Addressing this crisis demands a shift in both medical systems and public attitudes. Health providers must be trained to look beyond weight as the sole explanation for symptoms and to approach obese patients without bias, delay, or assumptions. Diagnostic tools must be adapted and improved to better detect tumors in high BMI individuals. Screening guidelines should be reevaluated to reflect the reality that obesity alters cancer risk, symptom presentation, and detection difficulty. And patients must be empowered with the knowledge that their weight not only increases cancer risk, but may also mask it, unless they take an active role in regular, thorough health monitoring. The link between obesity and cancer is well established. But the link between obesity and delayed cancer detection is an equally urgent and often fatal extension of that reality. Until it is acknowledged, studied, and addressed with the seriousness it demands, we will continue to miss our chance, again and again, to catch cancers early, save lives, and protect those who need it most.